Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen.
And welcome to the second Gadjah Mada International Conference on Tropical Medicine or GAMA-ICTM 2025. Dear ladies and gentlemen, this year's Center for Tropical Medicine Universitas Gadjah Mada focus on strengthening health system resilience for tropical disease control in a rapidly changing world, with a special emphasis on the transformative power of digital health and the urgent need for health equity.
From AI-driven diagnostic to telemedicine solutions, we will explore how cutting-edge technology can revolutionize healthcare delivery while ensuring that no community is left behind. And also, this conference is brought to you by Takeda Pharmaceuticals, ITS Science Indonesia, and also this conference is part of annual scientific meeting Faculty of Medicine, Public Health and Nursing Universitas Gadjah Mada 2025.
This event is also in collaboration with the media partner Media Indonesia, Republika, Harian Jogja, Star Jogja FM, RRI, Bakri Center Foundation, and Kedaulatan Jogja.
And also we would like to express our gratitude to our distinguished guests who already joined offline in auditorium FKKMK UGM. Dr. Yudi Pramono Mars as a caretaker of Director General of P2P Ministry of Health of Indonesia.
Selamat pagi Dr. Yudi, terima kasih. Profesor Dr. Yodi Mahendradhata, Master of Science, Doctor of Philosophy, Fellow of Royal Society for Public Health as the Dean of the Faculty of Medicine, Public Health and Nursing. Prof. Yodi, selamat pagi, terima kasih.
And also Dr. Citra Indriani MPH as a Director of Center for Tropical Medicine, Universitas Gadjah Mada, Directors of Research Centers, Head Departments and Academic Community of the Faculty of Medicine, Public Health and Nursing, and also in our collaborators in Universitas Gadjah Mada.
Distinguished partners of the Center for Tropical Medicine, Bu Ida, thank you. Prof. Tribaskoro, thank you very much. Pak Sudadi, terima kasih. Bu Egi, thank you very much for joining us in person today.
And also all speakers, moderator, judges of abstract presentations, esteemed guests, and also all in-person and virtual participants.
Dear ladies and gentlemen, this event is being conducted in a hybrid format, both in person and online. In this regard, we kindly seek your permission for the organizing committee to capture photographs and video recordings of attendees for documentation purposes throughout the event.
There will be a lot of several interactive sessions interspersed between the presentation by our esteemed speakers, during which we highly encourage and value your participations. For in-person participants, following the conclusion of the event, you are cordially invited to explore the facilities outside the auditorium, including the whole Bagia Experience booth, the trumpet exhibitions, photo corner where you can capture and print your memories here, and also the oral and poster presentation in the Grawiata building at the north part of this building.
We received a good number of high-quality abstract and the best practice submissions covering a wide range of topics regarding tropical medicine. We appreciate all authors and presenters for your contributions in science and tropical medicine in particular.
To kick off this conference meeting, I would like to ask your permission to stand up to singing Indonesia's national anthem, Indonesia Raya. Please be seated.
For the next agenda, dear ladies and gentlemen, we would like to hear the opening remark from the Dean of the Faculty of Medicine, Public Health and Nursing, Universitas Gadjah Mada. So without further ado, ladies and gentlemen, please welcome Professor Yodi Mahendradhata.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Honorable Director General of Disease Control, Ministry of Health, Republic of Indonesia, Dr. Yudi, honorable speakers, distinguished guests, colleagues, and participants, it's an honor to welcome you all to the second Gadjah Mada International Conference on Tropical Medicine. This conference comes at a critical moment in global health, a moment defined by political uncertainties, shifting global health priorities, and significant funding disruptions. 2 weeks ago, I was attending a meeting at WHO headquarters in Geneva. The mood there was depressing. It was depressing because of the exit of the US from WHO. So when I was there, they were announcing that this may be the last time they will hold an in-person meeting for a while, because after that, they would have to start limiting duty travels, in-person meeting, and other measures due to the funding cut from the US government. So in the recent withdrawal of the US government from WHO, the dismantling of USAID, the suspensions of CDC and NIH sent shockwaves across the global health community. All of those institutions have long played a major role in funding research and capacity building, including for tropical disease control, particularly in low-middle income countries like Indonesia. So their sudden disengagement threatens decades of progress in tropical disease control, health system strengthening, and pandemic preparedness. So our theme today, strengthening health system resilience for tropical disease control in a rapidly changing world, is very relevant. I don't know how the organizer forecast that theme because it happened before Donald Trump made the decision. But somehow they managed to anticipate about resilience, disease control in a changing world. So those are the three key words which needs to be emphasized here. So first, resilience. Resilience used to be about withstanding epidemic, pandemic, and climate change. But now it's not just that. It's also about surviving geopolitical and financial disruption. Countries that have historically relied on donor funding for health programs now must be more self-reliant, strengthening domestic financing and regional collaborations. Second, tropical disease control. Tropical disease historically is always underfunded, under-prioritized, and often dependent on external funding cycle, and again, political will from high-income countries. So tropical disease control now must shift from a donor-dependent to a more sustainable country-owned effort. And third, rapidly changing world. The traditional architecture of donor and recipient country relationship is crumbling, but the absence of the US institutions from global health actually presents not just a challenge, but also opportunities. Opportunities for regional health initiatives like ASEAN or emerging economies like Indonesia to take the lead and fill the void left by the US. So this conference serves as a platform to develop solutions, to forge new collaborations, and build a more resilient system within an uncertain time. But despite the uncertainties, one thing is clear. By working together, we can turn today's challenges into opportunities and create a future where tropical disease no longer pose a burden on the vulnerable population. So I would like to thank all of the speakers who have kindly committed their time to share their insight and expertise with us. Thank you also for the organizing team and the leadership of the Center of Tropical Medicine for your dedication in preparing and managing the conference. And last but not least, many thanks to all of you participating in person or virtually and enriching, of course, the discussion. So on that note, I'm honored to officially open the second Gadjah Mada International Conference on Tropical Medicine. Let's turn today's challenges into opportunities and build a new era of resilience that is independent, sustainable, and truly global. Thank you, and I wish you all a productive and inspiring conference. Assalamualaikum warahmatullahi wabarakatuh.
Thank you so much, Prof. Yodi, for your kindly warm welcome remarks. Coming up next, we would like to invite Dr. Yudhi Pramono as a caretaker of Director General of Disease Control and Prevention, Ministry of Health of Indonesia, to give remark and address the audience.
Bismillahirrahmanirrahim. Ladies and gentlemen, distinguished guests, the Dean of the Faculty of Medicine, Public Health, and Nursing, Universitas Gadjah Mada, Prof. Dr. Yodi, Mahendradhata, Director of Center for Tropical Medicine, Universitas Gadjah Mada, Honor Representative from the World Health Organization, Food and Agriculture Organization, and other international health organizations. Distinguished academic, researcher, and public health expert from esteemed institutes worldwide, policymakers, health practitioners, and representatives of civil society organizations. All delegates and participants who have traveled from distance to join us today. Assalamualaikum warahmatullahi wabarakatuh. Good morning and warm greeting from the Ministry of Health of Indonesia. It is great honor and privilege to join you today at the second Gadjah Mada International Conference on Tropical Medicine. I would like to extend my sincere gratitude to Universitas Gadjah Mada, Center for Tropical Medicine of Faculty of Medicine, Public Health and Nursing, and all organizing partners for bringing together experts, policymakers, and practitioners to discuss one of the most pressing global health challenges of our time, strengthening health system resilience for tropical disease control in a rapidly changing world. The theme of this conference resonates deeply with the challenge we face today. The burden of tropical disease remains a critical public health concern, affecting millions worldwide, particularly in low and middle income countries. In Indonesia, diseases such as malaria, dengue, tuberculosis, HIV, AIDS, antimicrobial resistance, and neglected tropical disease. To continue to pose significant threats to our population health, disproportionately impacting vulnerable communities, and however, as the world experiences rapid environmental, social, and technological transformation, we must adapt and strengthen our health system to address these evolving threats effectively. Ladies and gentlemen, Indonesia has made effort in combating tropical disease through policies, innovative intervention, and cross-sectional collaboration. And the Ministry of Health has been actively pursuing comprehensive disease prevention and control strategies, including improving access to universal health coverage, advancing vector control program with integrated surveillance and early warning system, promotion innovation, particularly in surveillance for emerging pathogen, developing of artificial intelligence, and pandemic preparedness, strengthening community engagement and primary health system to enhance disease prevention and response capabilities. Effort to prevent and control communicable disease remain a priority under disease control program, focusing on promotive and preventive approach to reduce morbidity, disability, and mortality. The Ministry of Health aims to limit disease transmission and prevent outbreak from spreading across region or international. Key diseases that continue to require special attention include HIV/AIDS, tuberculosis and microbial resistance, malaria, dengue, and neglected tropical disease. Tuberculosis remains one of the most significant infectious disease burden in Indonesia. The country has aligned its strategy with the global and TB strategy, prioritizing early case detection, increased treatment coverage, and improve public awareness. Indonesia has long been committed to tackling HIV/AIDS with the prevention and control effort involving to address shifting epidemiological patterns. Our strategies for antimicrobial resistance focus on One Health approach with emphasis 5 key strategies by improving education, strengthening surveillance, optimizing antimicrobial use, enhancing infection prevention. Malaria control continued to be a national priority with a strategic goal of achieving elimination in 2030. In line with that, dengue is also currently still a national priority with the existence of national strategy for controlling dengue 2021 until 2025 in having 0 deaths by 2030. The innovation currently being carried out in controlling dengue is the implementation of Wolbachia in 5 cities in collaboration with Gadjah Mada University, Yogyakarta, and implementation of independent vaccines. Effort to combat neglected tropical disease such as leprosy and filariasis have also been reinforced through integrated healthcare services and mass drug administration program. The Ministry of Health is committed to elimination entities as public health concern, ensuring that no community is left behind. Furthermore, immunization program play a pivotal role in disease prevention and health system resilience. Indonesia has actively strengthened vaccination strategies to protect against vaccine preventable disease, aligning with the immunization agenda 2030. Ensuring equitable access to vaccines and sustaining high immunization coverage are fundamental to preventing outbreak and improving public health outcomes. These national health priorities align with RPJMN of Indonesia, with underscore of 2 important sustainable health development, disease prevention, and equitable healthcare access. The RPJPN framework provides a long-term vision to strengthen Indonesia healthcare infrastructure, enhance human resource capacity, and integrated technology innovation to address emerging public health challenges effectively. To address this challenge, our approach must be collaborative, data-driven, and innovation-focused. We must continue to foster partnership at the national, regional, and global levels, leveraging expertise from academia, industry, civil society, and international organizations to drive transformative solutions. I am particularly encouraged to see the diversity to topic being discussed at this conference, from advancements in malaria vaccine development and climate change-driven factor expansion to digital health innovation and the One Health approach to antimicrobial resistance. This conversation will be pivotal in shaping the future of tropical disease control, not only in Indonesia, but across the globe. On behalf of the Ministry of Health of Indonesia, I extend my best wishes to a successful and fruitful conference. May this gathering inspire new collaboration and groundbreaking initiative in the fight against tropical disease. Terima kasih. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you very much, Dr. Yudi, for the opening remark for this GAMA-ICTM 2025. Ladies and gentlemen, to capture this beautiful moment, we would like to have a group photo from where you sit. So, participant, we would like to invite you to stand up while the photographer captures the photo from the stage and the projector will be turned off. So, ladies and gentlemen, please raise.
And also, we'd like to invite the participant who sit in the last of the chair to join with the others distinguished guests. For all of you can capture the moment together. So the photographers, maybe we can move a little bit. Rima?
I will. Oh, I don't mean to forget you, Pak Doni. Good morning, Pak Doni. Thank you for joining us. You are definitely unforgettable. I'm very sorry.
So we invite all the distinguished guests and also participants who are still behind the area of auditorium to join with us. Okay. Permit us to guide the photo sessions. First, 3, 2, 1.
Cheers.
Okay, please make another pose.
Let's do
3,
it, yeah.
2, 1.
Cheers.
Okay.
Oh, let's
Okay,
do the
so make a
UGM.
pose of UGM.
So we have this OK symbol and put it on your left chest, just like this. Yeah, it's the symbol of a signature pose from our university. So ladies and gentlemen, this would be the last one. So give your best smile in 3, 2, 1. Cheers.
All right, thank you so much.
Thank
You
you.
may return to your seat, everyone. Ladies and gentlemen, to enlighten in this morning conference, we would like to present to you one of the traditional dance in Indonesia.
This traditional dance is coming from Central Java, and the story would be about what, Mas Yopi?
Okay, Rima, and this dance is called Cakil and Arjuna dance. Right, Rima, this dance is from the Central Java. The Cakil and Arjuna dance features characters from Bambangan Cakil, a classical dance from Central Java. This dance narrates the battle between Arjuna, a noble knight, and a Cakil, a giant, or in Indonesia we call it as Raksasa.
Exactly. So to give you a glimpse of the beauty of Central Java, ladies and gentlemen, please welcome Cakil and Arjuna dance.
Mulat moro risang parato es muniro kamanungsan Tunjung Bang Trate Yang sori sang
Rima, such a interesting dance.
Exactly. I thought that you were one of them, Mas Yopi, no?
Yes.
Over
There should be 3 Cakil.
all three Cakils. Not you're not the Arjuna anymore.
No. It's more interesting to be Cakil.
Okay then, great. Well, ladies and gentlemen, this Cakil and Arjuna dance wraps our opening session for this morning, but we will definitely back with more exciting symposia.
And the participant and the singers guys can enjoy the refreshment that already prepared by the committee in the lobby around of 50 minutes. Please enjoy the coffee and tea and some snacks. And we will going back to the auditorium for the next symposium, the first symposium that will discuss regarding the looming threat and innovation and breakthrough on malaria control.
We'll be right back right after this.